I'd like to call the Human Services Committee to order. I am Judy Hopkins, Chairman of the committee. The first order of the day is to call roll for the committee members.
Mrs. Hopkins,
Here.
Mrs. Burdick,
Here.
Mr. Barnes,
Present.
Mr. Decker,
Here.
Mr. Havey,
Here.
Mrs. Root,
Here.
Mr. Stockin,
Here.
Mr. Crandall.
Here.
8 members present.
And Mrs. Washer, thank you for doing that. Do we need to have a roll call of the rest of the legislators in the room? Or not? We haven't done that before today, so, okay, great. Okay. Thank you. We are going to rearrange the agenda a little bit for Human Services. Our first order of business today will be to hear from the Office of the Aging. Kim Jeffers is going to be doing that report for us today. Thank you for coming, Kim. And you have your mic on, so we're good to go.
All right, thank you. I am here giving our Office for the Aging report on behalf of our director, Anita Madison. She apologizes that she was not able to be here, but she is very, very busy working with the pharmacies for vaccine clinics that are scheduled tomorrow. She did want me to point out that she will be available by phone if you have any questions. So the first thing that I wanted to present is our monthly report. The main thing that we wanted to highlight was if you look at the telephone calls at our front desk, this month we've had just over 2,500. This same time last year we had almost 1,900, so we're up 640 calls just for the month. Our homemaking personal care, which is PC2, and housekeeping chores, which is PC1, those are our home care services. Those are also well up from this time a year ago. Also, our caregiver services are almost double what they were last year, and home delivered meals, we are still at almost about 2,000 more than we were serving this time last year. Is there any questions on the monthly report?
Okay. Any questions for Kim? Okay, Kim, we do want to say thank you, a big thank you to your staff at the Office of the Aging. I know a number of those phone calls are certainly to help with establishing the waiting list for seniors who are waiting to get vaccines, and for you to be facilitating some of that through your office has been a big help, I'm sure, to the entire endeavor.
It has been, actually, I made some calls yesterday and today to people to schedule their appointments, and it's so nice to talk to people, and they are very, very thankful that we are getting through our list and working as fast as we can to get everyone vaccinated.
Yes, and that is certainly the whole goal of all of our days. So thank you. Mr. Barnes, did you have a question?
Yeah, I'd like to have the telephone number that we're supposed, I have a yeah, there you go. From Wellsville, who 84 years old, and she's concerned about getting the vaccination, and so where does she call? Who does she call? And
If she's not already on a waiting list, she can call the Office for the Aging main phone number.
what is that number?
It's 268-9390.
And Kim, why don't you just walk through that process really fast as what a person should say and do when they do call, because some of our people that are viewing this today might be really interested in knowing that.
Okay, so when someone calls in, typically they get a screening at the front desk when they answer the phone. If you are not already on the waiting list and you're interested in being added, you'll need to provide your name, your date of birth, and your address. Some people, depending on where we're sending them to, we're trying to get their Medicare number as well. So if they can provide that from their Medicare card. They go on to the waiting list, and then as we get allocations for vaccine, we go down in order and call them back and try to get them scheduled. Now that we've got a couple options, we try to do it, which is, whichever is most convenient for them, Fisher's in Wellsville, Alfred Pharmacy, and through the Department of Health.
Okay, thank you. Was there another question? I think Mrs. Burdick was first.
How many are on the waiting list now?
I do not have the most current number because between yesterday and today, I think we've gone through and taken at least 200 off. So that would be a good question for Anita. probably tomorrow morning after they've gone through the crazy of this afternoon.
Is that because of the Friday
A lot of them, yes, are for Friday.
allocations for Genesee County, or Genesee School?
Genesee Valley School, right? Okay, Mr. Havey?
Yeah, I have a quick question. This may be a trick question. So, how about seniors that are homebound? Have you heard anything about any
Yeah, because it is a suggested contribution, we do not monitor or keep track of, who contributes and who doesn't, because it doesn't affect their level of service.
Thank you.
Okay, any other questions or discussions on that motion? If not, all those in favor, please say aye. Any opposed? That motion is passed. Thank you. Kim, your last item here is the transfer of funds with unmet needs budget. That is for $1,500. Do you want to say a couple words about that?
Yep, our unmet needs grant is a relatively newer state grant that we received starting last year. It is to support it was originally to support our waiting list to help remove people from the wait list for services like home care and personal emergency response systems. We're moving this money around as the grant expires in March. The fiscal year ends in March. And we are just shifting this a little bit so we can get it spent, and we're using it to improve accessibility for seniors who need it to remain in their homes.
Okay, thank you. We'll need a motion on that. Mrs. Burdick makes the motion. Second, Mr. Havey. Any discussion, questions on that? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you very much. Kim, is there anything else that you need to add today?
No, that's all I had. Thank you all very much.
Okay, and again, thank you very much to your staff. And the next person we're going to hear from is our Commissioner from Social Services, Edna Case. Thank you for coming, Edna. Doing a little change in the mic here. Okay,
There you go. Thank you.
okay, you have your monthly report for us.
Sure. So you'll see that we have the new monthly report as promised, and starting in January. It encompasses pretty much all of the units that we have within the department. We also attached a key that explains the data. And if you'd like, we can attach that key every month if that would be more convenient for you, or if not, then we won't. But it explains what everything is within the data that you've received. You'll see that there's, on the back, you'll see that there's a lot of non-applicable items because we did not have the numbers for that statistical data in the previous to January. So those numbers will start, you'll see those filled in as February, and the rest of the year goes along as we present those numbers to you. If you look on the first page and you get to the RTA placements, I just wanted to cover that with you a little bit. We did receive the 20% gap payments for the previous quarter to April, and $279,543 were paid. That included full 20%, the withhold. And as of April 2020, there's still outstanding $984,360, and that money will be released based upon our RTA plan, which has been submitted but has not yet been approved. We are around $400,000. I believe Terry can tell me if I'm wrong, but I think we're around $400,000 that we would be owing in gap payments. And after April 1st this year, there will be no more gap payments. So we won't have to worry about sending that letter. So that's good news. And one other thing I wanted to share with you for the report is I wanted to also let you know that we received a letter from OCFS that the 20,000 withhold or the 20% withhold that they have had has been lowered to 5%, and the 15% balance should start being paid out between March 8th and March 22nd, but we'll still have a 5% holdout going forward. Any questions about that?
That's good news. Any questions for Edna? Okay, no, we'll go ahead.
So our MOE is asking to accept the donations from the Allegheny County Area Foundation. It sounds like they've made donations quite a bit around the county, which is a good thing. This for us is for the Child Advocacy Center. We would like to use, we were that amount was $2,500. We would like to use that amount for wraparound funding for families that come through the CAC that might be having some difficulties or barriers. Maybe they can't get their utilities paid, maybe their cars broke down, to help those families that come through the CAC door that need help that are from Allegheny County.
Okay, so we'll need a motion on that. Mrs. Root makes that motion, second by Mrs. Burdick. Any discussion or questions about that or any comments? Sounds like it's a good use of the money.
Yes.
Okay, if not, all
Great
those in
day.
favor, please say aye. Any opposed? That motion is passed. Thank you very much.
that's
And, wait, I'm on the, and you had a position request that was referred to the ad hoc committee. So we'll be hearing about that at another time. That was for a senior typist, I believe, right? Anything else you'd like to add today, Edna?
No,
Okay.
I'm good.
All
Glad to
right.
see you're all back.
Glad to be here.
Thank you. We're kind of learning our way through this new sound system and just being back together, and a lot of things on our agenda today. So thank you all for your patience.
All right, take care.
Great. Thanks, Edna. And our next report is from Tyler Shaw, our Public Health Director. I'm sure there will be questions. This has been a very, very busy time for the Department of Health, as we all know, through the COVID time of a year now. So we're looking forward to your report.
Thank you. First on the agenda is my monthly report. Just some highlights there. You'll see under January 2021, COVID-19 tests conducted, the 10,659. That is a New York State Department of Health number. That is not how many tests the Allegheny County Health Department has administered. Rough estimate of how many rapid tests we've administered is just over 2,900. Some other highlights from this month. I did complete a NISAC virtual conference. I was one of the presenters on rural COVID-19 vaccine distribution, along with some White House briefers and as well as Westchester County's Commissioner of Health. We have a rabies clinic coming up. I did give you a flyer. It's April 17th at Genesee Valley Bus Garage. It's going to be a drive-through clinic from 9 to 12, and pre-registration is required for that event. And last, kind of for the month, is I do have a letter here that I was copied in from Senator Borrello's office in support of Allegheny County receiving COVID-19 vaccination clinics, either mass vaccinations or additional vaccines. So if anyone's interested in that, I do have a copy of that here as well. So thank you to Senator Borrello's office for that advocacy.
Thank you, Tyler. We're all very aware in the county of how few vaccines have been allotted to our county, and I know that you and our administrators have all been advocating for that. I know the people in the hub that you are associated with have been advocating for it as well. Dr. Nancy Nielsen was on, I believe, Channel 2 News recently, advocating for that. So we hope that that can have some results and that we can get more vaccines coming our way. And if they could grant a mass vaccination site, that would be a great help, not only for our county, but for the surrounding counties as well.
Absolutely.
So, thank you. Okay, we have some, a KOS agreement to look at.
Yeah, so this is an annual renewal of our maintenance agreement between the WIC program and KOS Inc. This has been reviewed by the IT department and recommended to move forward with this agreement.
Okay, we need a motion on that. Mrs. Root, second by Mr. Havey. Any questions or discussion on that? Okay, all those in favor, please say aye. Any opposed? That motion is passed. Thank you. Next, we have another agreement from Grants and Brinks.
This is for the WIC building for their telephone system. This is a maintenance agreement. And this has also been reviewed by the IT department as well as the county attorney's office.
Okay, thank you. I need a motion on that. Mr. Stockin, second by Mrs. Burdick. Any questions, discussion? All those in favor, please say aye. Any opposed? That motion is passed. Thank you. Moving on to the next one. The Allegheny County Foundation grant.
Yes, we have the opportunity to apply for Allegheny County Area Foundation grant to help with either COVID-19 vaccination clinics or rapid testing. And we decided to apply for PPE or personal protection equipment for our employees for these clinics. So we are looking for approval to apply for this grant.
Okay, we'll need a motion for that, please. Mrs. Root, second by Mrs. Burdick. Any discussion on that? I would just like to mention that in a recent discussion with one of the personnel working at the vaccination clinics, that all of the peripheral materials that are necessary, like the PPEs and the Band-Aids and the swabs and everything else, are not provided along with the vaccines. That's up to us to provide those ourselves.
That's correct.
So, yes, this is important. Thank you. Any other questions on that? All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Okay, Tyler, next.
Okay, next is acceptance and appropriation of our performance incentive money. This money was awarded to us for our performance in expedited partner therapy for the treatment of chlamydia. And we're looking at a total of $14,515. And on the sheet, we're appropriating it for health equipment and office equipment. And down below, that's to replace our existing vaccine refrigerator and freezer. Our current vaccine refrigerator is on the fritz, so we're looking to replace that. And with the new VFA guidance, we have to have 2 separate standalone units in order to be compliant with the state's regulations.
Okay, and we certainly don't want to be caught down without that, as the vaccines will continue to be coming for many months. So we'll need a motion on that. Mr. Hamey, a second by Mr. Stockin. Questions, discussion? All those in favor, please. Oh, Mr. Barnes?
So, does that mean that right now, with only one freezer, we can't get vaccines?
No, we don't have ultra freeze capacity for Pfizer right now anyways.
Okay.
We've partnered with Jones. If we are to get an additional allocation of Pfizer, they would act as our distribution hub. We're not getting Pfizer at this point, we're getting Moderna, and we have the freezer capacity to store that.
Okay, so that doesn't require the super cold?
It does not.
Okay. Thank you.
Good question, thank you. I think we're ready to vote, though. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And the next one is a memorandum of understanding with Genesee Valley.
Yes, I'm looking for approval to ratify the county administrator's signature on this memorandum of understanding with Genesee Valley Central School for an agreement for, the USDA. They're looking for, our department for intervention services and our public health department, as well as our WIC department. So really what they're looking at, it's a pipeline for educational success, which is a federal grant program. They're looking for us to participate in 2 school-based events, and for our WIC program and children's services to work collaboratively to disseminate project-related materials to eligible clients, which we already do at this point anyways, and to participate and work cooperatively to enable and effectively evaluations to be completed by independent agents, which also our Children's Services Department is also doing. So this really helps to expand our services out into the school districts, especially Genesee Valley and Wellsville Central School, who are in this grant. So we're looking for approval for that.
Okay, so we'll need a motion to approve that. Mrs. Burdick, second Mrs. Root. Any discussion on that? All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, Tyler. And the next one is the request to transfer funds.
So originally, we did not budget for the WIC state conference. We anticipated that to be canceled due to COVID-19. However, the state is doing a virtual conference, which requires a conference expense. So we're looking to move money around in the WIC program.
Okay, and so that is for $1,500. We'll need a motion on that. Mr. Stockin, second Mr. Barnes. Any questions about that? Okay, all those in favor, please say aye. Aye. Any opposed? That motion is passed. Thank you. Okay, and then we have a request to extend the sunset date for two temporary part-time office aide positions. I believe these were the ones that were mandated by the federal government to
There,
help with COVID, is that right?
There are two separate allocations. So we have 4 office aides who currently are covered under the federal grant allocation. These were 2 additional part-time office aides that we had asked the county for in order to help with our workload, and we still need those positions. I did put the sunset date, hoping for August 31st of this year.
Right, right. You and I have had a conversation about this, and with all of your staff so involved with the vaccination clinics and the testing sites and all of that, that these office aides are essential in terms of covering the office and answering questions on that. So
Absolutely.
we need a motion to extend the date on that. Mrs. Burdick, second by
Granting issue, it has to be new staff, and these positions were not in the original 2021 budget. They would be considered new.
And we're coming up on the deadline. Can I just ask our county administrator, is it okay for us to go ahead and vote on this then, or?
Yes,
Do we need-
but it will need to be referred on to a resolution.
Okay. Okay. Okay, all those in favor, please say aye. Aye. Any opposed? Okay, that motion is passed. Thank you. Thank you for your question, Mr. Harris. Okay, Tyler, do you have any other things that you want to bring to our attention? And I believe that we're going to request an executive session for a couple of things, but anything before that, or any questions from the floor?
I just wanted to thank all the county departments who have helped our office, county administrator's office, treasurer's office, social services. There's tons of county departments that are answering questions for us and answering questions from the public. We really do appreciate it. It is really an OFA helping us out with the waiting list. It's really been a team effort. We could not do this by ourselves. So I do appreciate everyone pulling their resources and helping our department.
Okay, thank you very much, Tyler. We're looking for a motion then to go into executive session for the reason of number 6, the medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. So I'm looking for a motion. Mrs. Burdick, need a second? Mr. Stockin? I'm sorry, Mr. Decker, I didn't see you over there. All those in favor, please say aye. Okay, we are in executive session.